hopefully this has illustrated that HIV is an important cancer risk factor. So much so that based on some of our work and work of others, HIV was added to the list of official carcinogens by the US government. So now it joins ultraviolet radiation and nitrate high foods as a federally recognized carcinogen. So all of this buildup to talk about cancer screening, well, the reason that I give all of this buildup to talk about cancer screening is that we have some very important issues that make this a complicated consideration. And a lot of times we don't have time to think about these things, but right now we do. But, you know, I want to introduce all of these concepts so that we can think about how we're approaching cancer screening for people living with HIV. Because remember, most of our cancer screening approaches, but not all of them, were established in people without HIV. And there may be some unique issues to consider. So we have an aging group of people whose cancer risk is going to be increasing. They experience quite a bit of multimorbidity, which makes their medical management very challenging. They may have a lot of competing needs, and sometimes maybe cancer screening might feel less important, and sometimes it is less important. They have a varied life expectancy. So some of our patients, were started on HIV treatment right away. They have perfect immune function, and they may have a different life expectancy than a patient that has had adherence issues or other complex behavioral issues. And so their benefits of cancer screening might actually be different. There's functional status. I think many of us are probably seeing patients that struggle with functional issues that may impact their benefits of cancer screening. But at the same time, we have increased cancer risk. And so screening might be more important in certain situations, because we might be seeing a patient whose risk of anal cancer is 50 times the normal. So this can be a very complex set of decisions. And remember, sometimes it's very hard to do this, but cancer screening is always a balance of benefits and harms. Cancer screening, there pretty much is no form of cancer screening that doesn't potentially have some harm associated with it. And so we have considerations like we see in this figure here, where when we think about certain cancer screening tests, what are the chances that our patient might experience a false positive test or might experience some sort of screening harm associated with our decision to do screening? And what makes this even more challenging is that we don't have a lot of data for people living with HIV in terms of what are the exact benefits of cancer screening and what are the exact harms of cancer screening. So in many situations, we have to apply what we know from the general population to our patients. But what I would encourage you to do, and I try to think about this, and this is really just a very qualitative set of considerations. And I'm going to go through in a minute talking about each type of cancer screening and how we can think about these things. But when we're thinking about cancer screening, I like to sort of quickly in my head think about, what is this patient's cancer risk? Is it more than the general population? What might the benefits of screening be for this patient, related to their set of illnesses and their HIV? What is their life expectancy? What are issues impacting their life expectancy? Is cancer screening worth it in this situation if life expectancy is significantly altered? And are there any unique harms of screening that this patient might experience that may potentially be related to their HIV?